So with this episode, I wanted to start off with the hospital price transparency law. This law was passed in January 2021, and there's some rules and regulations that were created to make the cost of medical treatment, the cost of hospitals, a little bit more transparent to the average consumer, because we know there's a lot of variables that come into play when you go to the hospital and you get your medical bill. Everyone's bill is always different. There isn't really a set standard for things, even though there is a set outline for procedures, a set outline of what's done with each intervention. Each patient is different, so everyone that walks into the door, they might need a similar treatment or a similar surgery, but there's going to be a little bit of variation in that procedure, in that treatment. For example, just like at your mechanic, you have multiple models, you have multiple makes, and even though you might have to change the brakes on, let's just say, a Toyota Camry, and you might have to change the brakes on a Jeep Wrangler, even though it's the same idea, you got to change the brakes. These brakes require different pads, require different rotors, require different amounts of time for that to be done. So there is a lot of variability when it comes to mechanics, when it comes to cars, same way when it comes to people. But in the mechanic world, you have a set database on what part is going to cost you, how much time it's going to take, and they have it charted. They have it in a system that gives you the price right away, versus healthcare where there really is no upfront cost for anything. They can't even really give you a ballpark idea. So I was thinking, is there any way that maybe we could take the model of automobiles, of mechanics, and maybe transfer it over to the human population? Because cars and vehicles, they're very structured, but they're very well followed through, and they're very well documented, because you drive this car, so the ins and outs has to be known to almost every single shop. So why can't we also do that with humans, where we could almost gauge how much things are going to cost us? Because when I looked up, for example, how much a bypass costs, so the average cost for a bypass is anywhere from $30,000 to $200,000. That is a very wide margin. There's a really big price discrepancy, and I understand that, yeah, one might be an emergent bypass, one might be more of an elective bypass. So that's where that price differential is in emergent versus elected. But why is there such a giant discrepancy between 30,000 and 200,000? So depending on where you go, you might be charged 2 or 3, 4, 5 times more than somebody else, right? So I found that really interesting. So I decided to dig a little bit deeper around that, and I ran into a post I ran into on Google saying that recently there was a law passed on hospital price transparency. Of course, not every hospital abides by it. I did look at a few hospitals that I have worked at while travel nursing, and I also have looked at a few hospitals that are around me here in Chicago. And 9 out of 10 of those hospitals, they had a database of, you can put in your information and you can get a general idea of how much you have to pay. Some of those sites, some of those hospitals had you call a phone number and provide your information details and what you're looking for. And other hospitals, they just had a database where you put in your first name, last name information, and you put in your insurance information, and you're able to click on how much a cardioversion will cost you, how much a colonoscopy will cost you, just based off your insurance. So you already know upfront on how much it's going to cost you before you decide to go in that direction. So it's almost like you're able to shop for things. So when it comes to healthcare, it's not like money. People are a little hush about money. Same with their medical problems, medical treatment. They're always hush. And now you have this combination of both money and medicine, where both sides are hush, and that's why the costs have never really been disclosed or talked about, because it's something that people just don't want to talk about. It's two of the things that people want to talk about the least, is their money and their health problems and their health care. Nobody ever wants to talk about those things because it's personal, it's private, and you got those here in hospitals where you got both of the hush hushes. You got the money and the healthcare related, and nobody wants to talk about anything. So that's why hospitals are able to keep these prices and these costs non-disclosed, because nobody really wants to talk about them. You don't hear people talking about, hey, how much did your stent cost you? Hey, how much did your ER visit cost you? Maybe we're hearing that a little bit more now about the ER visits or the doctor's visits because we're post the widespread infection. So people have been talking about it a little bit more over the years, and it's kind of here to stay. It's a new norm, because I had a bunch of people ask me how much I pay for like an ER visit, how much I pay for a specialist, so on and so forth, because people are trying to get better deals, because we're becoming a little bit more conscious in that sense, versus with my parents and stuff like that. They never really cared about or talked about how much it's going to cost them. They just went there, got it done, and then they dealt with the bills. But we're becoming a little bit more conscious about our hospital costs, which is good, because we should be, because if you're not talking about it, someone's probably taking advantage of it. And not gonna lie, hospitals have definitely taken advantage of consumer spending and healthcare costs, because it was never really talked about. It was always talked about in closed doors. It was always talked about between the CEOs. It was never really patient talking about it, right? Like when you go to the mechanic, you always get like a second or third or fourth opinion. Who's gonna give you the best cost? That's what you're gonna go with. Here in healthcare, your second, third, fourth opinion aren't really so much focused on the cost. They're so focused more on what the next steps are. But now we're entering this, I'm going to say, societal pivot, where people are going to be asking about a second, third, fourth opinion about what they should do, but also the cost of that, which makes healthcare a little bit more of an open circle and not so much hush-hush. We'll discuss it behind closed doors. So with the hospital price transparency law, there's three things that really go into it. The first one is a comprehensive machine-readable file, which is basically a database or a data sheet of the prices of how much the hospital is going to charge you. It has to be fairly simple to read by a machine and also by humans, so transactions are a little bit smoother, and the person actually knows what they're going to pay for it with their insurance, or if they don't have insurance, how much it's going to cost them without insurance, so on and so forth. The second one was a display of shoppable services. So a clear display of shoppable services means that shoppable services are things that are elective, like an x-ray, lab test, simple procedure. Some of the more common stuff that people get more routinely, hospitals are required to disclose those costs as well. Things that they could maybe do ahead of time, not necessarily in the hospital, you know what I'm saying? Not necessarily where they have to, they're feeling sick, they go to the ED, get some blood drawn, and then they go home and they figure out some of that they can maybe schedule ahead of time. Maybe you're coming in for some kind of back problems and the hospital wants to draw your blood, do scans, all that kind of stuff, but it's not emergent. They want the hospitals to be able to display the cost for these things. So maybe if you're aiming to go to the doctor tomorrow or go to the ED, maybe you're going to hold off on it for a day because it's not so urgent, and you're going to get those tests before then having to go to the hospital, and then them doing the test where it's always a surcharge, where it's always priced in higher. A lab draw in a hospital is always going to cost you a lot more than a lab draw if you just go to like a mini clinic, or if you just go to any of the outside clinics when it's more elective, not in-house. The in-house stuff is always going to run you 2, 3, 4, 5 times more than it would do at like a clinic, because hospital wants to maximize on each service that it provides. So it's going to charge you a lot of money for the simple services because it's a big system. So we want to always get the value out of it. It's just as good of a lab draw if you do it at a hospital or a clinic. It's the same lab draw, same thing, but hospital's always going to charge you the most out of that. And the third thing on here is penalties if you don't abide by this transparency law. So I also looked at the penalties, and the penalties are, for example, if you have a hospital with 30 or fewer beds, you're going to be charged about $300 if you fail to display your costs or the prices or this information that this law requires every single day. If your hospital has 31 to 550 beds, you can have a maximum charge of $10 per day. So you could end up paying, if you have 550 beds, you could end up paying $5,500 per day the hospital is going to pay. If you're a hospital, if you're a huge hospital that has more than 550 beds, well, you're capped at that $5,550. So hopefully this makes these hospitals step their game up a little bit and be able to provide a little bit more transparency than they have over the years, because medicine is never talked about. Healthcare costs are never talked about. It's always, like I said in the beginning, it's always hush hush, and this has to be changed because you should be able to shop around. You shop around for every single thing. Every single thing has a price on it, and you decide if you want to do it based on a price. Can this have like a double-edged sword where people might want to not have surgery because of the price? They might. It's definitely a factor, but it's also going to be able to have this person shop around for a better price on the surgery, which is nice because this might actually decrease costs. There's going to be a little more competition because if you have two hospitals on a similar location and this hospital is charging $100K for a procedure while this hospital is charging $80K for a procedure, well, person that's charging $80K is probably going to have more people come to that hospital because you're saving $20,000 per surgery. In a sense, the hospital is making $20K less per surgery, but they can maybe make it up in a volume because you're going to have more people push towards there. And then a hospital is charging $100K, maybe they'll drop their price to $75 or even $80, matches, so on and so forth, where there's going to be more competition. So when there's competition, there's always going to be a competition over the price, and usually the competitor that does either the best job or has the lowest price usually succeeds. And if you could have the best job with the lowest price, that's your way to success in a competitive market like this.